Hey everyone. Welcome to CalAIM Links Kings Tulare Session 3 titled Best Practices. My name is Shiva Diman, and I will be one of the facilitators today alongside my colleagues Melissa Meza and Alexis Taylor. I'm a health equity project coordinator at HealthBegins, and at HealthBegins, we are a national mission-driven consulting and training firm. It's our goal to help healthcare and community partners improve the social and structural drivers of health equity for patients and communities. Next slide. Before diving into the introductions, we'd like to take a moment to thank you all for joining us today. It's really important to us, and we're really glad to see the turnout that's here today. We'll have a very dynamic session that prioritizes information sharing, so participation is highly encouraged. Next slide. We'd like to let everyone know that today's session is being recorded. And you will be able to have access to this recording on our YouTube channel, as well as our HealthBegins website, which I'll talk a little bit more about in later slides. Importantly, we'd like to extend a special thank you to our project partners. CalAIM Links is a collaboration of Transform Health, Aurrera Health, and HealthBegins. We are being generously funded by the California Healthcare Foundations, and to learn about any of our project partners, we've actually included hyperlinks in our presentation materials that will redirect you to their company site. As mentioned, our work is funded by the California Healthcare Foundation, and we'd like to extend an incredibly special thank you to Carlina Hansen from the California Healthcare Foundation, who has invested an incredible amount of knowledge and resources to make this work possible. Thanks, Carlina. Because we focused on ensuring that our learning sessions are reflective of your needs, I'd like to share what we've heard back from participants and the plans. Through conversations, readiness assessments, polls, and surveys, we've learned that the CBOs are experiencing contracting gaps with reporting requirements, braiding and blending funding, data sharing, billing and claims, contracting pathways, and best practices. The MCP feedback was provider interest forms, MCP certification applications, reporting requirements, gap filling, and also best practices. To date, we've covered all of these topics, and we'll now focus on blending these into just one last bullet, which is best practices. As mentioned at the top of this meeting, this is the final session of a three-part series that focuses on how to become a community supports provider. So just to provide some context, session 1 focused on contracting pathways, standard terms and conditions, and certification processes. Session 2 focused on understanding financial and reporting requirements, and session 3, today's session, will incorporate those lessons and feedback we've received into best practices. If you want to access any of those materials that are in this slide, the decks are hyperlinked in today's presentation, and the recordings are available on the CalAIM Links microsite. You can access that at www.healthbegins.org/CalAIM, and you can also see our YouTube channel as well. Just look up HealthBegins on YouTube. That being said, building upon what we have learned over the past year, by the end of this session, participants will be able to understand the best practices that will aid community supports providers in navigating the contracting process with managed care plans in Kings and Tulare counties. In order to accomplish our objective today, today's agenda includes meeting plan representatives, understanding why community supports matter, sharing provider success stories, a brief Q&A part 1, covering best practices, another brief Q&A part 2, and then important next steps. Based on the objectives entailed, we assume that today's attendees are CBOs located in Kings and Tulare that are interested in direct or indirect contracting with Anthem or HealthNet to provide community support services. You will have an immediate, intermediate understanding of CalAIM. If you don't worry, because we have a volume of foundational information on our website that will get you up to speed. And lastly, you've completed a readiness assessment to let us know how prepared you are to fulfill a contract with an MCP. Now that we understand our goals for this session, we would absolutely love to get to know one another. Relationship building is a key component of becoming a community supports provider. We'd like to remind everyone that we are amongst friends and colleagues that are highly experienced in providing important services. So we want to strongly encourage communication between attendees and facilitators, but also, and just as importantly, between participants. To set the tone, we'd like to ask everyone to update their Zoom name and their preferred pronouns. We encourage that you use the chat throughout this webinar, and we'll kick things off with sort of sharing our names and organizations in the chat. And to make sure we truly break the ice, we'll conduct a rapid round of introductions. So please share your responses to the following 2 questions in the chat. Question 1, how do you hope community supports will advance the work you do? And question 2, what do you hope to get out of today's presentation? Alexis, do you want to go first and kind of give a little bit of an intro?
Yeah, hi everyone. My name is Alexis Taylor. I am one of the senior program managers here at HealthBegins. I am the lead for our CHCF funded CalAIM work, and I'm so excited that all of you are here with us today. And then to go ahead and reflect on the questions, how do I hope community supports will advance the work that I do, and what am I looking forward to today? Most importantly for me, as one of the facilitators for this session, I'm looking forward to learning from all of you and making sure that we are facilitating the information in a way that is eye-opening for you, to make sure that the contracting process becomes less of a black box and more of something that feels accomplishable, something that's very digestible, and something that you can walk away with understanding, wow, my organization can do this, and it relates to our mission and vision. And pertaining to how community supports advances our work, as Shiva mentioned earlier, at HealthBegins, we are a mission-driven training and consulting firm, and our priorities are advancing health equity. And because CalAIM has this focus on population health, we understand that the community support services that are being rendered are going to work to improve population health. And so that's critically important for us, very important. And so I see that our plan partners are not present just yet. So what I'll do instead is just call on a couple of the members that I see that we have, or a couple of the participants we have here. I see that we have an Brandon Moreno from Kings. If I'm not mistaken, Brandon, I think that you have joined us for previous sessions. So if you wouldn't mind doing a very quick intro for the other participants that are here and just sharing briefly, what you hope to get out of this session, that would be so wonderful.
Hi, I'm Brandon Moreno from the Kings County Human Services Agency. I have attended these meetings before. I'm not sure what exactly I'm going to be trying to get out of it because we're already contracted with our 2 healthcare providers for community supports. However, we're also ending those contracts at the end of this year.
Thank you so much, Brandon. And so I'm really excited to hear that you've already facilitated the contracting process, because with this specific session being focused on contracting readiness, we really want to uplift the best practices that other CBOs and community organizations that have contracted can share with the other providers that are on the call, and also hear back from you if there are any implementation questions that you have, because like I said, we typically have the plans on these calls, and it's great for us to document that information so that way we can continue building a better infrastructure for those community supports providers. And I'll pass it back over to Shiva to call over on a couple of other individuals to unmute and introduce themselves.
Yeah, awesome. Great to hear from you, Brandon. Can we get Mark Montgomery to maybe unmute and share a little bit as well? No worries. Calling someone else. It's all good. I know we're still getting warmed up for the webinar today. How about Artemisa Valdez? And I'm really sorry if I pronounced your name wrong. Please correct me if I did.
Hi, good afternoon. My name is Artemisa Valdez. You pronounced it correctly.
Awesome.
I'm the regional director for the Tulare County programs. We are looking forward to we're going to start working on our CS program. So looking forward to learning a little bit more on how everything, the whole process is. I've been attending the meetings, so it's very informational. I appreciate all the information we can gain, and we're getting ready to start working on this effective December or January at the latest.
Great. And then one more, can we get Sonia maybe? Sonia to introduce yourself and just let everybody know.
Hi, good afternoon. My name is Sonia Duran Aguilar, and I'm the Director of Population Health at COEA Health in Tulare County. We are currently participating in enhanced care management and also 2 community support services, housing, navigation, transition, and sustainability. And much like the first gentleman who was on the call that was called on, I'm here just listening. I'm gleaning a lot of information. I don't know that I have a set agenda other than just to attend and absorb as much as I can. And as questions come up, ask them.
Awesome. Yeah, great to have you guys all on. Why don't we go to the next slide? So I don't think Brandy and Leslie are on right now, but I'm sure they will join, and they're wonderful individuals. Brandy is part of Anthem and Leslie is at HealthNet, and they are here to serve as resources and champions of your learning. So we want to launch 2 poll questions. This is the first one. The first one is, where are you in the contracting process with your health plans? Go ahead and provide those responses in the poll that's appeared in front of you. And it's really helpful for us to sort of garner these responses to tailor future sessions as well. So we encourage everybody to vote on the poll. Give it another couple seconds. Awesome. Great. And then why don't we move on to question 2? And question number 2 is about which types of community support services does your CBO have experience providing? If we could get everybody to click on those that they represent, that would be great.
And I'm actually sorry, Melissa, I think we need to relaunch that poll really fast. Sorry about that.
There we go. Wait for a few more responses to trickle in. Great. Awesome. And then let's jump into the next slide. Thank you everyone for your introductions. It's been great getting to see who all is attended and some of the landscape of what we're working with here. And from this point on, I will introduce my colleague, Melissa. And Melissa, it's all yours.
Thank you, Shiva, for setting the tone for today's session. So we're going to quickly just talk about community supports and just provide you with a quick refresher, including why they matter. My name is Melissa Meza. I'm a senior program manager with HealthBegins and the associate project manager for CalAIM Links. Before diving into contracting best practices, like I said, we want to provide you with a brief recap. So what are community supports? As a brief recap, community supports are medically appropriate, cost-effective services that managed care plans can offer in lieu of traditional Medi-Cal benefits. This means that they are not combined with Medi-Cal benefits. However, they are provided as an alternative to Medi-Cal benefits. They are optional for any managed care plan to provide, and they build upon the equitable learnings from the whole person care pilot. And managed care plans are highly encouraged to contract with CBOs. Hopefully we'll have Leslie and Brandy join us today so that they can provide us with more information on how to connect with them and provide these community support services. There are a couple of roles that community supports providers have, so we can identify how you fit into this. Community supports providers are organizations with expertise in the community and in the specific support they are contracted to offer. This means that you already are the experts in these services, but now you can get paid through the state to provide them. Community supports are an amazing opportunity for local providers to provide Medi-Cal beneficiaries with services that have not previously been accessible through Medi-Cal and that address for their social determinants of health. Your role as a community supports provider is one, to contract, deliver, and meet. What does this mean? So contracting is community supports providers will contract with managed care plans and become a part of their network of providers. In many cases, expanding the network to CBOs who previously have not played a role in Medi-Cal. What do we mean by delivering? So this enables you to deliver critical medical and social services such as housing, navigation, recuperative care, medically tailored meals, or community transitions, which are not typically funded by Medi-Cal. And finally, your role as a community supports provider is to meet contracting and reporting requirements. As providers in the Medi-Cal system, community supports providers must meet the MCP's contractual requirements, such as those related to care models, billing, and data sharing, which Alexis, our project manager, who's also on the call today, will cover a little bit later. So who can provide community supports? As you can see, the types of entities that can be community supports providers vary. These include vocational services agencies, affordable housing providers, life skills training and education providers, supportive housing providers, county agencies, federally qualified healthcare centers and rural clinics, public health hospital systems, providers of services for individuals experiencing homelessness, social services agencies, and substance use disorder treatment providers, including county behavioral health systems. I once again want to reemphasize these organizations are already experts in providing community support services. We have some of you on the call today, and now you can contract through a managed care plan to expand your network and provide important services to your community. DHCS has actually already pre-approved 14 community supports that may offer services. And so these 14 are included here on the screen. They include housing and tenancy supports, recuperative care and respite services, nursing transition services, supportive food programs, and home modification services. There are detailed descriptions of these services, including eligibility and service limitations, can be found on the DHCS Community Supports Policy Guide on the DHCS ECM ILOS website. And that link can also be provided in the chat. MCPs may also submit proposals to offer additional community supports that are not on this menu, and those are subject to DHCS approval, so you'll have to discuss that with them. And finally, why do community supports matter? Mainly they matter because of the goal of CalAIM is to address not only health needs, but health-related needs. This means we are addressing social determinants of health by addressing the needs of the whole person. Under CalAIM's population health management approach, managed care plans will implement strategies to health-related social needs that focus on wellness and prevention. CalAIM also uses a whole person approach to address both medical and social determinants of health needs, therefore, and avoiding higher levels of care and associated cost. Finally, this serves to improve quality outcomes and reduce health disparities. And here we also have some facts that highlight the real purpose of why these are so important, which includes the fact that 27%, we've seen a 27% reduction in inpatient psychiatric admissions for housed individuals. We've also seen improved quality of life, reduced substance abuse, and improved physical and mental health. And finally, data reveals the annual rate of emergency department visits is 75% lower among housed individuals compared to unhoused individuals. If you want to access this data, you can access the link in the chat, which will be shared by my colleagues Shiva and Alexis. All in all, we can see that community supports have a very positive impact on the community. And now I will go ahead and hand it over to Alexis to cover provider success stories.
Thank you so incredibly much, Melissa. I really appreciate, number one, Shiva, you setting the tone for today's session. As referenced at the top of the call, we really want this to be very bi-directional, making sure that we are not just, reading slides on a screen to you, but actually being super reflective of like what your learning needs are, any challenges that you might be facing. And so breaking down, why community supports is important is a great way for us to segue into that dialogue. But I did want to reflect on one of the questions that was dropped in the chat by my managing director, Sadhna. We realized, in the polls that number one, we have a number of housing providers that are present with us today. That's amazing because the first success story I'm actually going to reference is a housing story. And that's because as we've collected data over the past year, we've seen that almost 40% or more of the participants that join these sessions are housing providers. We understand that the housing market in California is very challenging, making the work that you provide quite literally invaluable. It's imperative. And so I see that, for those that are contracted, Brandon, you mentioned that your contract is going to be ending at the end of the year. So Sadhna is just asking, do you plan on initiating a new contract with that provider? And if there's anyone else that wants to provide reflections on that same question, that would be very beneficial to us to also know how to best leverage this time. And then for those CBOs that are present that are not contracted, that's wonderful because we can absolutely provide you with those best practices to navigate this process. And then for those individuals that are considering recontracting, maybe we can talk through some improvements that could help you navigate that supplemental process in the future. So Brandon, if you wanted to give us some light to that feedback that you had earlier, that would be so wonderful.
Sure. Our contract was only for a year anyway, but we had chosen to opt out and to discontinue continuing community support services. So that was a choice made by our department to be effective at the end of this year. And we will not, we are not planning on re-upping that contract or continuing to contract at this time.
And was there anyone else that had any feedback on, their contracting duration and, whether or not they are going to pursue future contracts? And then for those that are uncontracted, I can't remember, sorry, based on the response that we received in the poll, but for those that are uncontracted, does anyone have any feedback on, just the best way to spend this time, like facilitating those best practices for you? Or if there's a specific area of the contracting process that still feels like a black box to you, that I can make sure that I emphasize as I cover, these next couple of sessions. And I believe, if I'm not mistaken, during the intros that Sonia and Brandon were already contracted. Let's see, what about, Mark, I'm so sorry, Mark, were you one of the uncontracted agencies? And are you actually able to hear us now? I don't think that Mark can hear us. And then what about Artemisa?
Yes, we're actually already going through the signature process. So we're pretty much on board, just waiting for our signatures to get through our corporate office.
Nice. So with you going through the signing process, that means that you all are still in the negotiations process, like you've reviewed the non-binding pricing guidance, all of that, or are you still redlining that contract?
They're still reviewing. So
awesome.
Yeah.
Okay, wonderful. That is really good to hear. Wonderful. And so
Alexis, sorry, I just had just one more question. I don't mean to put Brandon on the spot here, but
yeah.
I just thought that for like the purpose of best practices for some of the peers here, I'm wondering if there is anything that you would be willing to share, Brandon, without putting you on the spot. And if the answer is not really, that's fine. But just in terms of like having gone through community supports over this year and choosing not to do it for the next year, is there anything that you do feel comfortable sharing with peers about like considerations for contracting that maybe you learned that's going into your decision to not pursue it for next year?
Well, for us, it was a number of reasons. I think some of that had to do with our cost effectiveness, with the cost of our staff and the amount that for that. It was a challenge with the billing aspect of things and the referring of things. This is something that we're just not used to, you know, being a human services agency. It's a different whole life, you know, and asking for permission to serve and take care of somebody, whereas we're normally just automatically serving somebody and taking care of things as we do authorizations and referrals. And that's a whole new world that we're not used to. And we've had some challenges getting through some of the billing aspects and other things that we're still working through. So I would hope, though, that, you know, being 10, 11 months in now, or 11 months in, that some of those challenges that we faced, being some of the first that had rolled out, many of those things may be ironed out by now. But for us, there were some definite growing pains and some challenges that we had to work through that we're actually still working through. So that was some of the reasons why we chose not to continue being a provider.
Thank you so much. That's super helpful for me to hear, and I'm hoping for some of the other folks on the call to hear. And so thanks, Alexis, for letting me squeeze that in.
Yeah, no problem, Sadhna, whatsoever. And I think that was also incredibly helpful for me to hear, because as we walk through these best practices, we also want to talk about the resources that are now available. Something that's really important to uplift about the information that was just shared is this is a rapidly changing environment, and there are systems and protocols and practices in place today that certainly were not a year ago. So in addition to that being just a very, you know, valid causation for why, you know, one organization has assessed, you know, what their experience was, there are more resources and more structures in place today that were not previously. And I really hope that we're able to really bring forth that, you know, support for capacity building, that support for resources, the funding of outlets and pathways that are available now, because we want to make sure that CBOs are being pulled into this process. That's what's most important, right? Making sure that at the end of the day, this expansion of services is reaching those marginalized populations, reaching those underserved populations, so that way they can have health-related need services provided on a regular basis. So if we can move into the next slide. For anyone that may have missed our intros at the top, my name is Alexis Taylor, and I'm fortunate enough to lead our CalAIM work here at HealthBegins in partnership with our project partners, of which I believe our partner at HealthNet just jumped on. Yes, we have Leslie here. Leslie is an amazing individual. She steers the CalAIM work for these counties over at HealthNet, and we'll give her an opportunity to introduce herself. And I also rendered this work alongside my colleagues, Melissa, Shiva, and Sadhna, my managing director, who you all just heard from. So before diving into these contracting best practices, I really just want to exemplify why community supports matter by highlighting a few incredibly meaningful success stories. And so starting off with this first one, I wanted to start off with the housing trifecta. I just recently heard someone call all three of the housing community support services the housing trifecta. So unfortunately, y'all will be stuck with me saying the trifecta for the rest of, you know, the CalAIM implementation. So the housing trifecta refers to housing navigation, tenancy supports, and deposits services. And we received a story through DHCS from Sacramento Covered, an organization up in, you know, Sacramento that provides these housing services. And so there was a 35-year-old woman that had 4 children under the age of 10. I have 2 children. That is already financially challenging and straining enough. So just imagine having 4 that are under the age of 10. She was gainfully employed, but she still struggled to secure housing. As I mentioned previously, we all understand that housing in California has been a historical problem, and that's why the expansion of services to provide these funds for housing are critically important. And so before CalAIM, many of us are familiar with the whole person care pilot. She was able to secure a housing voucher underneath that pilot, but she experienced a major unfortunate setback, and that led to her being transitioned into a family shelter with her children. Anyone with children can empathize wholeheartedly with that situation. And so under CalAIM, Sacramento Covered was able to utilize the housing trifecta to provide permanent housing for this mother and her family. And I think that we all know that housing is quite literally health, right? Melissa mentioned some of the impacts earlier as to why having housing is directly related to health outcomes, including those related to ER admissions. And so this individual was so thankful and appreciative of that experience of having housing that it was just really warming to hear and see that she had sent pictures to the Sacramento covered team showing her giving her children a birthday party in what was now their home. Something that we might take for granted at moments, the fact that someone has a home. And so utilizing that housing trifecta, Sacramento Covered was able to place 131 individuals in permanent housing over just the course of 8 months. And that was just one organization. So imagine if we are amplifying that impact across hundreds of organizations across the entire state. And something else I think that's important to mention in this moment is that other states are also looking at California to see if CalAIM is going to render the benefits that we assume it's going to render, to see if they can also put those same services in place. So not only amplifying this one story across California, but imagine amplifying that one story across the entire country. That's something that's very powerful. And so if we move to the next slide, I'd like to also share a success story regarding medically tailored meals regarding an individual named Brett. So Brett is a diabetic. He had a hand injury. He had experienced a hand injury, had to have surgery, and his physicians worried that he would not be able to cook himself healthy meals. Something that unfortunately, I personally take too much advantage of being, busy with work or having other things that I experience and just going to grab something really fast. That is not only financially unreasonable for some individuals, it is also detrimental for some individuals because those meals are not going to have the nutritional value that an individual with an underlying condition is going to need to meet their health needs. So Brett was referred to a medically tailored meals program, and based upon the meals that he received, not only did he not face readmission into the hospital because of his diabetes and not being able to have access to healthy meals, he also stated that he feels better now than he had in a very long time. Specifically, he says that my diabetes has gotten better with these meals. I've kept my weight down. I feel much, much better now than I have in a long time. And I'm one of the people that this program is meant for. And if we go into the next slide to once again exemplify that impact that I was just discussing, because of services addressing not only health specific needs, but health related services that address the social drivers of health, there has data that documentally displays that there's been a $36,000 reduction in healthcare cost for individuals that receive recuperative care, which is now a community support. There's been a 59% reduction in readmissions for individuals that receive medically tailored meals, which is now a community support. There's been a 40-point reduction in inpatient days for individuals that have comprehensive housing supports, which is now a community support. So once again, I know we started off with discussing what are community supports, why they're important. And before we go into the best practices to secure that contract, we really just wanted to amplify that by putting names and stories to the supports that your organizations actually offer. And as Melissa mentioned, are the experts in providing. So now we're going to dive into our best practices section. But before we do, we wanted to have a very brief poll that says, for you to please review the list of historically marginalized populations that are going to pop up on your screen. Which of the populations represent at least 20% of your organizations served, or sorry, your population served in 2021? And I'm not sure for this one if we actually structured it for you to select all that apply, but please select the one that is the most relevant to your organization. This is also important for us to know, who's attending these sessions. What are the populations that you serve? What populations are community supports to date actually impacting? So this data isn't just for the purposes of learning more about each other in this session, it's actually for, a larger aggregational component so that way we can know the impact of the sessions that we're hosting as well. And we can just keep that open for just a few more seconds. And if anyone has not responded, you can go ahead and drop your response in there. All right, and we can go ahead and end that. and share the results. So we definitely have a number of Medi-Cal serving, obviously, Medi-Cal serving populations here. We have rural communities that are served, disabilities, individuals experiencing homelessness accounts for 4 out of 6, 67%, of the responses that we just received. And also other underserved populations and those individuals, suffering from serious mental illness. And so if we go on to the next slide, before we dive into those contracting best practices, I just wanted to give you some high-level takeaways from what we've covered thus far. Number one, as Melissa outlined, community supports are medically appropriate, cost-effective services that MCPs can offer in lieu of traditional Medi-Cal benefits. Number two, this is an amazing opportunity for local providers to provide Medi-Cal beneficiaries with services that have not been accessible through Medi-Cal. Just as we said, you have been providing these services. They were not previously covered by Medi-Cal. So this is an amazing opportunity to tie in an entirely different funding stream into the services that you already provide. And then lastly, there is significant data to justify how community supports services play a fundamental role in meeting enrollees' needs for health and health-related, really focusing on that health-related services that address the social drivers of health. And we're going to pause very briefly just to ask if there's anyone that has questions on that foundational information before we get to the meat of the conversation. So did you have any questions regarding that community supports refresher or why community supports matters? All right. All right, thank you all so much. And just reviewing the chat really fast. Okay, perfect. All right, so moving on to the meat of the conversation, those contracting best practices. I want to start off by actually capturing the contracting process. As Shiva outlined at the top of this call, we've already conducted a number of sessions that exhaustively, just very comprehensively translate the DHCS and the MCP requirements in sessions 1 and 2 that were geared towards King and Tulare counties. And then also we have foundational statewide sessions that are available on that CalAIM links website that we dropped in the chat. So if for any reason, any of the components that I discussed right now feel like they might be a little too high level, please pause and let me know. I can definitely recapture that information, but you also have those resources that are already developed specifically for you that are available in the deck that we shared in the chat. We'll make sure to drop that deck in the chat again, and they're also available on our website. So to really truncate this contracting process, the first thing that you're going to do is obtain an NPI, which is your National Provider Identification Number. This is something that you're going to get from CMS. We've already included a link to that NPI portal in this deck itself. We're also going to drop that in the chat for you. And all this number is before you even enter the contracting process, you just have to have an identifier. You can kind of think of it as like your driver's license of like entering these contracting processes. Before you can drive a car, you got to have a license. Before you can move forward in this contracting process, you got to have an NPI. When you're going to submit to become a certified provider for a plan, you obtain that NPI, and the next step is for you to submit a letter of interest. For these counties specifically, Anthem and HealthNet are your plans of interest, and we've included the links to both of those letters of interest for both of those plans. Those letters are very short. Just ask for information on your organization. Based on the information that you provide, you'll get invited to complete a certification process. So that's the next step of the contracting process. So this is where you can see there's a lot of meat in the text that I've left right here. So this certification is the application that you're submitting to the plan, so that way you can become a CS provider. What's really important about this process is that you just validate your experience. It is very intentional that we keep saying you are the experts at providing these CS services. And so as you submit that certification, you're just going to validate all of the experience that you already have. Let the plan know, what your experience in providing whichever community support that is. And so you want to make sure that you use the DHCS provided service definitions, because those definitions are going to let you know exactly what the state is looking for. And then you tie your services into that application using those definitions. For example, something, very mundane. If you are, going to apply to be a cook, you wouldn't really want to put in language that is geared towards you being an engineer. You want to make sure that you actually use the language that is very specific to those supports that you're going to provide. What's amazing about Kings Tulare and Anthem and HealthNet is that they really wanted to make sure that they were reducing the administrative burden of submitting these applications. So you do not have to submit applications, that certification application for each one of those plans. One application can be used for both plans. They will work with each other to certify you. As we mentioned, we have both of the plans that typically join in these calls. They work in very close, proximity with one another. And so they understand if you're going through this contracting process, they don't want you to have to go through it twice. So you can use that one application to go ahead and move forward with contracting for both of those entities. And then just to give you some notes about the application itself, you need to complete the provider information section, the general provider section, and complete the sections for the community supports that your organization specifically wants to provide. I know that might seem like it's very straightforward, but we have received questions from CBOs such as, do I just complete, the community support section for what I'm going to render, or do I have to complete all of them and explain why we don't do that? You don't have to do any of that. Only complete the sections for the community supports that your organization is going to provide. All right, so that's step 2. After you submit that certification application, you're going to go through what is called a gap filling process, because there are requirements that we're going to go through that DHCS and the MCPs have for you with being able to fulfill those community supports services. Once they receive your certification application, they're going to look through it, they're going to redline it and say, hey, we see some gaps that you're experiencing right here. We need you to rectify those. Here's how you can rectify those. And then you're going to work with your organization to make sure that you get those gaps filled. After all of those gaps are filled, you move forward to the negotiation process, which one of our participants today let us know that they're in. You justify your rates and then you finalize your contract. And we're going to go through the best practices of navigating this process. But at a high level, those are the 4 components. Submitting that letter of interest, going through the certification application, completing the gap filling process, and then negotiating to finalize that contract. All right. And so with that being said, with our high level overview of what the contracting process is, now we can actually get into those best practices to help you navigate that process as easy as possible. So the first thing that we recommend is that you self-assess your organization's readiness to meet contracting requirements. Well, what does it mean to self-assess? That is a very vague term. How do we self-assess to make sure that we are prepared to become a provider? So if we go to the next slide, I want everyone to remember that in order to become a community supports provider, your organization must meet both DHCS and plan requirements. What's amazing about this is that they have already outlined all of these requirements so that way you can access them. We have hyperlinked those requirements inside of this deck. We're dropping those requirements into the chat for you right now. But most importantly, we want to demystify what those requirements are. And so there's going to be a model of care and the DHCS standard terms and conditions. So when you are self-assessing your organization for readiness, those are the 2 documents that you are referring to, the model of care and the standard terms and conditions. And in the prior sessions, we have gone over these exhaustively. So first, the managed care plan's model of care is their strategy for providing ECM and community supports to its members. Each managed care plan is going to have a plan that includes its approach, its policies, its procedures for partnering with those providers, for administering those supports. So essentially, you just need to make sure you review that model of care to see how your organization is going to fit into that plan. Second, you need to review the standard terms and conditions. So the standard terms and conditions are going to be the requirements that DHCS is outlining that needs to be met in order for you to contract with an MCP. Those requirements are going to pertain to service delivery, quality and oversight, data sharing, and payment considerations. And so as you are self-assessing your organization, you're looking at those 2 documents and you're making sure, oh, I have, the ability to fit into these requirements. And if you don't, that is okay. Like, that is what's really important for us to say right now. If you don't currently meet those requirements, you can prepare as a part of this self-assessment. So that leads us to our next part, which is the assessing your internal policies. So as you're looking at the standard terms and conditions and you're looking at the model of care, you want to review those requirements and ask yourself, hey, do we meet those requirements, or do we need to establish workflows that are going to get us to that level of readiness that we need in order to fulfill that contract? That's quite literally all that means. So for example, if there is a DHCS requirement that gives you, for example, a minimum amount of or a certain bandwidth of hours that a phone has to get monitored, right? For example, must be able to accept calls between like this hour and that hour, must be able to respond to referrals within X amount of days. Okay, great. What policies or procedures do we need to implement to make sure that we can meet those requirements? That's quite literally all that means. So when you're assessing those internal policies, you're creating workflows to make sure that you can meet those. Next, you want to prepare for reporting requirements by reviewing the minimum data elements that you'll need to collect. So that's PHI, and assessing what standards need to be established in order to collect that information. As a community supports provider, there's certain information that you just might not collect because this is not a requirement. So as you move into becoming a CalAIM contracted provider, you would need to collect those data elements. And all of those data elements have been listed in one of the prior sessions in session 2, which we stated was linked within this content. So as you look through those data requirements that must be collected, you just examine your systems to see if you're already collecting that information, which information you're not collecting, and then set up those processes so that way you can collect that information. That's important because you are going to render reports to your managed care plan, and they in turn have to render that report to the state. So that's why collecting that data is not something that's optional. You need to have the workflows and the processes in place to make sure that you are collecting that data, and it has to be in a very safe and HIPAA compliant manner. Next, as you're self-assessing, you've learned what the requirements are. You've assessed your internal policies to see if your policies are in alignment with DHCS and MCP requirements. You looked at your reporting practices to see if you're collecting the correct information. Now you need to see if you have the correct systems in place. And so you're going to assess your data needs, see what billing and storage systems that you need, if there are any other IT changes that you may have. And we've covered all of that in the second session as well, comprehensively. Because like I said, we're just going through how to self-assess, and then like within each one of these areas, we already have a total breakdown within a prior session. And then lastly, after you have completed those other 4 areas to self-assess, the last thing you want to do is look at your workforce capacity, because once again, DHCS and the plans have a workforce capacity requirements. And so you may need to hire up, and that's totally fine, because once again, we're going to also move on to other best practices that tell you how to leverage the funding opportunities that are available to be able to build up that capacity. So just as a recap, the first best practice is for you to self-assess your organization's readiness. And these are the steps that you would take to self-assess. I just want to be very, very, very specific about saying that this is not an overnight process, and that's fine. We have a lot of content that walks you through each one of these phases so that way you can be successful. Something I'm reflecting on right now in this moment is that back in September, I believe, this year is going by so fast, my team and I went to Sacramento, and we were presenting at the Centurion Care Conference, and some of you may have been there as well, on just why relationship building is so important to being able to fulfill this process. That's relationships between you and other peer organizations, relationships between you and the MCP, because it can feel confusing and overwhelming the first time that you see it, and that is totally fine. And so when I said that out loud at the conference, one of the participants literally went like this, yes, because they realized it was not just them. Like, this process seems like a lot, and it's quite literally our job to like demystify this, break this down. And we really want these best practices to serve as like a guide to get you through that contracting process. And for other providers that have already, are working towards exhausting their contracts and they may be thinking about re-upping for next year, we really hope that you can leverage this process as well. And as we move forward, we'll also be able to discuss those opportunities that are available that were absolutely not available at the top of this year. All right, so if we move to the next best practice, we're recommending that you determine which contracting pathway works best for your organization. So we've already talked about self-assessing, and we're going to talk about how you can build the capacity to be able to conduct that self-assessment. And we understand like there's a lot of work that's required to do that. So you have an option here. We don't want you to assume that you have to take on all of that administrative burden. You can contract directly with the MCP, or you can contract with another entity that would take that administrative burden on for you because they have contracted with an MCP and you would just contract with them. So based on the data that we've collected thus far from providers, we realize a lot of the individuals that join our sessions, and at this point, we've had over 1,000 individuals that have tuned into our TA sessions. And a lot of them do not have experience directly contracting with a managed care plan. And they do have experience contracting with, for example, another provider or a county agency. And that is a contracting pathway that you can take. You can take advantage of that, as a part of becoming a community supports provider. So if we go into the next slide, I'll actually break down what that means. So as I mentioned, there are 2 contracting pathways to becoming a community supports provider. So the main pathway, sorry, I do see that we have, there we go. Sorry about that. I was just looking at the chat. So we do have 2 contracting pathways to becoming a community supports provider. The main is going to be contracting directly with an MCP. The rest of this session will pertain directly to that. But the other pathway, as mentioned, is contracting through another contracting entity, such as a county agency or another, provider. If you contract with, if we move to the next slide. There we go. If you contract directly with an MCP, in this scenario, the managed care plan is going to contract directly with you as the provider, and they're going to require you to meet all of the criteria that I outlined at the top of this section. So that's, the standard terms and conditions, your ability to meet service delivery criteria, capacity, data sharing, your ability to bill, just all of these administrative requirements that we also talked about. And so MCPs have a process for demonstrating readiness to contract as a community supports provider, and they'll work with you to address any gaps that you have in your readiness to fulfill those services, as I discussed earlier, and as we're going to take a deep dive into later. So that's your first pathway, directly with an MCP, going through the contracting process, submitting a certification application, going through the gap filling process, and then negotiating your rates for your contract. So the second option that you're going to have, as I mentioned, is contracting with another contracting agency. So this is going to be an indirect contract. So in this scenario, you would be able to contract with, an FQHC or a county agency, and they would essentially be, an administrative hub for you because they're going to be able to take on some of that administrative burden. You would indirectly contract with them, making them the primary contract holder. And so that means that they would take on the responsibilities for data sharing, reporting, invoicing, so on and so forth. The specifics would be between you and that contracting entity, but it could greatly reduce the burden that you as, a provider would have as an indirect contractor. All right, so if we move to the next slide, I just want to briefly recap that thus far, the best practices that we've discussed are self-assessing your organization. We've broken down exactly how you can self-assess. Next, we want you to determine the contracting pathway that's going to work best for your organization. And then next, practice number 3 is leveraging available funding sources for you to navigate not only the gap filling process, but also to support you throughout implementation. I know I have presented a lot of information thus far. I promise you we're going to have a Q&A right after I finish best practice number 5. So you can feel more than free to drop those questions in the chat and one of my colleagues can get back to you, or you can save those questions for us when we get to that Q&A. So this is where we receive a lot of questions. So please more than free to let me know if there's anything that you want me to pause on, re-emphasize, and we also have content that breaks this down very comprehensively. I'm giving something very high level as a best practice, but we have covered this content in multiple sessions, but I'm putting into a very streamlined process for you as a part of this specific session. So if we go to the next slide, what do we mean by leveraging available funding resources to be able to build capacity? So now that you've self-assessed your organization and you've determined which contracting pathway that you're going to pursue, assuming that you want to move forward directly with MCP contracting, we have a chart here that really outlines how you can leverage funding to become a community supports provider. So as mentioned before, after a provider has submitted that LOI, you've gotten your MPI, you've submitted that LOI and your certification application, you're going to go through this gap filling process with the MCP to address the gaps that were, identified in your application. DHCS understands that there is a lot of capacity that needs to be built for a provider to be able to fill those gaps. These are not light requirements, and importantly so, right? It's not light requirements because they need to make sure that the entities providing these services and the entities being funded to provide these services are well qualified to provide these services. So it's very meaningful that this process is in place to make sure that the providers are just well vetted. So to meet, the financial burden, the administrative burden that comes along with, submitting this application and going through the gap filling process, multiple programs have been designed to get you funding to support this. So the first one I want to talk about is IPP, which is the Incentive Payment Program. These funds can be used for you to hire a consultant to help you through the contracting process. As we mentioned before, there is this understanding that a lot of the providers that want to join the CalAIM process have never contracted with a managed care plan before. I previously worked in the city of Pasadena, overseeing funding for CBOs in Northwest Pasadena. And one of the issues that we saw, even with those HUD programs, the CBOs had never done this before, so they didn't know how to navigate that process. So there was hands-on TA that was available to help them get through that. And you can kind of think of this as, as a hands-on opportunity for someone to come in and help you navigate this process. You would be able to leverage those funds or receive those funds directly from the managed care plan. And those funds are going to be available again, or the application window opens in December. So there are no funds available right now, but as of next month, there are going to be additional funds available, and you would be able to work with the managed care plan to figure out exactly how you can tap into those funds. So as I mentioned, you've completed your LOI, you've submitted the certification application, you are working with the plan to fill those gaps. And now, pertaining to the gaps themselves, what funds do you have available to actually help you reach those requirements, those staffing requirements, the development of those billing systems, being able to make sure that you have the storage systems in place to meet DHCS requirements, so on and so forth. Well, now there's an entirely different funding source that you can also tap into, and that's going to be your PATH funds. So as a part of the PATH program, which we'll drop a link to in the chat for you as well, there's a program called CITED, and CITED stands for Capacity and Infrastructure Transition, Expansion and Development. I dare anyone to say that 5 times fast, because I have been repeating this for months and I still can't say it just naturally or fluidly. But the point being, in addition to those IPP funds that you can leverage to be able to navigate the actual certification, application process, you can also leverage cited funds to be able to build the capacity that you need to contract and, support you throughout implementation. So there is a catch to these cited funds. Cited funds are specifically for contracted providers. But if you're a provider that is in the contracting process, you're working through gap filling, you are, reaching the point of negotiation, if you received a signed attestation from the plans that you're working with that are validating that you are, on the path to becoming a community supports provider, that is how you're able to tap into these funds. These funds are not for uncontracted providers. So, your organization as a standalone entity that is not providing community supports, you cannot tap into this individually. You need to be a contracted entity or, in the contracting process, receive that attestation from the plan to say, yes, this organization is, working to fulfill, this contract. So those are the two funding sources that you have available to you, essentially, in this process and throughout implementation. And so to be a little bit more specific, if we go to the next slide, as I mentioned before, DHCS knows that there is a considerable need for providers to build this capacity. So for IPP specifically, you can use those funds. You get those directly from the managed care plan. That can be used not only for the certification application itself, but also for you to build staffing needs if you have, any needs that you have in that area. Moving on to the PATH funds that, were cited specifically, the very long title that I read out, there is $1.44 billion that's available in that PATH pot, of which, cited as one of those programs. And so under the cited initiative, they really want the providers to be able to not only go through this contracting process, but to also make sure that you are sustainable. That is a question that we have received before, how sustainable is this program going to be? And so that is what those funds are also available. So those funds can be used for workforce development, outreach, and IT infrastructure and more. And as I mentioned, which is very important, so I'm really sorry to sound like a broken record, those funds are specifically for contracted providers. So you as a CBO standalone that is not rendering community supports, you cannot tap into those funds. You have to be a contracted provider or, working to fulfill that contract. So that way you can take advantage of those funds. And then in addition to IPP, in addition to those those cited funds, there are also two more PATH initiatives that you can tap into once you have actually secured your contract. In 2023, there are two amazing initiatives that are being launched, which are going to be the TA Marketplace and the Regional Collaborative Planning Groups. So to give you a little bit of information on those, the TA Marketplace is going to be a place where you can go virtually online from the comfort of your desk or computer to quite literally say, hey, this is an area that my organization is having a challenge with. How can I receive support to make sure that we are, thriving throughout implementation? That is not something that was here a year ago. That program doesn't exist now. It's quite literally still being built out. So even after you've navigated this contracting process, you're not alone. There are going to be a host of TA providers available to make sure that you are being supported throughout implementation. Hopefully our organization will also be listed on that TA Marketplace as a vendor that you can come to receive support. And then secondly, it's really important that CBO voices are uplifted and that you are able to uplift those challenges, issues that you're experiencing, and also those bright spots, things that are amazing that are happening as a part of your community supports work. So something else that we're also going to be involved in next year is going to be those regional collaboratives in which we're going to convene groups of CalAIM stakeholders to discuss exactly what's going on in the CalAIM landscape so that we can uplift solutions to decision makers and create policies that really reinforce improving community outcomes and bettering population health. All right. So if we go to the next slide, I just want to give a very brief recap. That thus far for best practices, we have discussed self-assessing your organization. We walked you through exactly how you can self-assess. We've let you know you can determine which contracting pathway that's going to work best for your organization. Best practice number 3 that we just covered was leveraging those available funding resources. And I just have 2 more best practices to get you through, and then we'll open it up for a Q&A. So best practice number 4 is going to be for you to review the non-binding pricing guidance and assess costs before entering negotiations. I think that this is something that we have really tried to emphasize over the past year, is that when you are entering negotiations, there is this entire pricing guidance document that DHCS has created to quite literally walk you through what it means to assess your cost, what considerations you should be making when you go into negotiations with the managed care plan, so that way you don't leave anything out. And it's not just for the CBOs, it's for the managed care plans as well, because we understand that service cost in one location is not going to be the same as service cost in another location. So it's not standardized. And so if we go to the next slide, I just wanted to briefly recap how you get to the point of needing that non-binding pricing guidance. So as I mentioned, you're going to complete the gap filling process. You've worked with the MCP to address all of those action items, and then they're going to develop a contract for you after you have completed and fulfilled those gaps. When you receive that contract, you need to review it comprehensively, ask any clarifying questions that you have, redline it, provide any edits. But most importantly, when you're responding to that contract, redlining, and this is, also very specific to one of our participants right now, you want to make sure that if you have any revisions to make, that you justify those costs. Justify any of the calculations that you have provided, so that way the plan understands why you have responded with the rates that you are proposing. So the non-binding pricing guidance, which we are going to drop in the chat, and it's also hyperlinked inside of this document, is going to give you a very comprehensive breakdown of all of the costs that you need to consider. So if we go to the next slide, I'll be able to break down exactly what that looks like. So even though the non-binding pricing guidance is it's a moderately length document because it has guidance for based on community support. So you don't have to read, everything. You can go to the supports that are relative to you. But I do want to let you know like the types of considerations that it quite literally outlines as a part of that document. So let me see here. So, how did this non-binding pricing guidance get developed? So DHCS, they consulted national, state, and local experts, including CBOs, healthcare providers, payers, advocates, and finance experts to develop pricing benchmarks. So, a median cost of these services across California, but then also a range of prices, like an entire scope of prices that could very well relate to the services that you provide. That's why the guidance is non-binding. It's not saying, hey, this is the rate, you have to stick to this rate. It specifically says non-binding because they want to let you know that they worked with an actuarial company to come up with the range of prices and the average, benchmark of those prices. But you need to assess your organization by reviewing exactly what I'm going to discuss right now to determine what your costs actually are. So the first thing they're recommending that you assess are your staffing models and program needs. What does this mean? It means what staff are going to be required for you to meet programmatic need and service delivery. What are the associated costs of those staffers? They also want you to assess your service offerings and capacity. What are the costs of administering the program? Do you have any subcontractors that you pull into this process? Do you have administrative costs? Do you have infrastructure costs, IT, billing systems, data storage, so on and so forth? And so while this is a very high level overview, the pricing guidance breaks down all of this so that way you can have a very clear understanding of what they're proposing that you assess when you are determining what your actual costs are. Something that was very helpful for me to hear from one of our plan partners was, there were a number of CBOs that went into this process and they were fearful, are we going to turn, a profit? Are we going to be able to actually, meet our costs by being able to render these services? And that's exactly why this pricing guidance is here. And so if you're able to go in, use this guidance, map out exactly what your costs are, you are going to be able to meet the needs that your organization has to render those services successfully. And if we go to the next slide, I'm so sorry that I just did not have time to make this next slide pretty, but it was something I threw in at the last second because I felt like it was very relevant and important. If you click on the non-binding pricing guidance that we dropped in the chat for you, you're going to see pricing recommendations at the bottom of that document. So it's going to give you, like I said, the name of the service, the type of unit that they're calculating. So is it a per diem? Is it hourly? So on and so forth. The midpoint range and the midpoint rate, which is that median that I was letting you know about, and also the overall rate range. So this is what, a very targeted cost analysis is providing as a recommendation. A lot of information and data points was invested into coming up with this range point, but you need to, look at the non-binding pricing guidance, assess your own costs, and then actually make sure that you go into negotiations having a very clear understanding of this information and what your actual costs are. All right, and so going into the next slide, I know that I'm listing this out as best practice number 5 because the others are, more technical, they're very specific. I wanted to make sure you had a very clear understanding. But best practice number 5 is quite literally one of the most important, and that's going to be building relationships with your CBO peers and the managed care plans. I cannot stress enough how awesome our plan partners are. That includes Leslie, that's on the call with us right now from HealthNet. That includes Brandy. I'm not sure if Brandy was actually able to join us today, but I'll still give her all the accolades with her not being here. And then mutually, just equally important, all of the peer CBOs that have connected with other CBOs that are interested in providing community supports that have really helped them navigate this process by sharing their best practices, which is why we always reach out to those contracted entities as well, for them to join us on these calls, uplift their best practices, respond to any questions that may come up from those peer organizations. This is literally a long-term partnership to advance health equity, and we are encouraging you to cultivate strong relationships with your peer organization and your MCPs, uplift those bright spots and share those best practices and those challenges. Earlier, I made reference to one of the challenges that have been uplifted, and it was the CBOs themselves saying, hey, oh my God, it's a lot of burden for us to submit this, certification application for both of the plans. And so the plans, were able to work together on the back end to say, hey, our processes are very reflective, they're comparable, we can accept one application. It doesn't matter whether it's the HealthNet application or the Anthem application. We can accept either, and we will move you, help you navigate this contracting process so that way you don't have to do this multiple times. And if we go to the next slide, which is our last slide, plans understand that for the most part, CBOs entering this process, you have never contracted with the managed care plan. Like I said earlier, that's totally fine. I want you to remember at the top of the call, Melissa mentioned that community supports are not required of the plans to provide. And that means that for the plans that are providing these services, they're being incredibly intentional about improving outcomes by providing this expansion of services because it's not a requirement. And it's also important for me to share that there are even more services coming online in 2023. So it is quite literally your plan partner's goal to make sure that we are improving population health by expanding, exactly what types of services are being provided. Equally important, as I mentioned, you are the experts in providing these services. And so being able to connect with those peer organizations is just so key to sharing best practices, moving your work forward, collaborating, so on and so forth. And then if we move on to the last slide. I just want to briefly recap all of the information that I was able to share about those best practices. And so, as mentioned multiple times, the first was for you to self-assess your organization's readiness by reviewing those requirements. There were 2 things that I referenced. You wanted to review the model of care and the standard terms and conditions. After you review that, you want to say, hey, where do my policies fit into these standard terms and conditions and the plan's requirements and goals, for their approach to rendering community support? Are there workflows that I need to create? Great. Okay, let's go ahead and set up those workflows to meet those requirements. After you've self-assessed your organization, you want to determine which contracting pathway works best for you. Moving forward with the MCP, you will be able to leverage funding resources to build capacity during the contracting process and during implementation, including those resources I just shared with you about the PATH collaboratives that are coming online in 2023 and the TA marketplace that's coming on in 2023, where you will be able to access continued support. The next was to comprehensively assess the non-binding pricing guidance for negotiation considerations. I can't stress how important that is for you to actually assess your organization's cost, to know exactly how much it's going to cost you to render these services. And then lastly, to go ahead and build those meaningful relationships with MCPs and those peer organizations. That being said, we are going to run through a couple of last quick polls just to learn from you a little bit, and then we'll close out with a Q&A. And so if we launch that next poll, I just wanted to ask everyone, which of these takeaways was the most helpful for you? Was it learning why community supports matters? Was it the contracting refresher that we had kind of in the middle of the session where we walked you through, submitting the LOI and the certification application, going through gap filling, and then closing out with the contracting process? Or was it one of the best practices that we shared? So we just went ahead and launched that poll. Please take a minute. We'll leave it up for about 60 seconds or so. Please take a moment to just let us know exactly, what the most helpful takeaway for you is. All right, and so we have about 30% that have submitted a response. And if everyone could just take a couple of seconds just to submit their response, that would be super helpful for us, because even though this is the third session for Kings Tulare, unfortunately, you won't see our faces in this specific series anymore. We definitely want to make sure that we are learning from you, so that way, as we move this work forward in 2023, we know exactly what is helping other CBOs understand this process and just navigate this process. All right, and we can go ahead and end that poll. Thank you so much, Melissa. All right, and I'm seeing that the contracting process refresher was something that was really leading the pack there. That is very interesting and just so important for us to hear. Really appreciate that feedback. And so I know that we've covered a lot today. I know a number of you have probably already seen the previous sessions that we've hosted. You probably reviewed the content that was on contracting, not best practices, but the actual processes themselves, standard terms and conditions, billing, payments, so on and so forth. And so we just want to pause, for a moment. I will actually, Melissa, can we stop screen sharing just for a moment? Just to see, does anyone have any questions about this contracting process? Do you have any feedback for us, so on and so forth? We just want to make sure that we are answering your questions and just being as available as possible. We also have our plan partner, some HealthNet on the line. So if you have any questions for them, we also just really want to make sure that we're uplifting your needs.
And Alexis, overall, I do want to thank you guys for these technical assistance sessions that you've been having for our providers. I know a couple of them had to hop off early, but just, putting the information all together in one concise and cohesive place has been really great. So thank you.
No, thank you so much, Leslie. We really appreciate, just all of the feedback that you provide to us to make sure that the content is so relevant to what, is needed in the landscape. And so thank you so much, Artisma. I see that you said that the information was really helpful. I actually did have a question, for, our participants today, especially for those that have not finalized. No problem, Nicole. Thank you so much. And for those that have not finalized their contract yet, I just wanted to know, I know that we've, responded in the poll to see which one of those sections, was the most helpful, but do we have any specific takeaways that may have landed perhaps easier for you as a part of these best practices? Did that make, does it feel like this information has streamlined the process for you? Like I said, we really want to be able to help you move forward in contracting readiness. And we also want to take these learnings back so that way we can help other organizations in other sessions as well. So Artisma, would you be able to maybe expand upon that just a little bit? If there was anything specific that was helpful to you? Oh, I'm not sure if she can hear me actually. Artemisa, are you able to hear me? All right, no worries whatsoever. And so I do believe that we just have a couple of just closeout slides very quickly. And if anyone has any questions, please feel more than free just to unmute. That would be totally fine. And so I just wanted to close us out. If we go to the next slide, yeah, there we go. Would we be able to get some quick feedback? I'm so sorry. Actually, we can skip this one. Yeah, I'm sorry about that. Let's just go ahead and go to what comes next. So as I mentioned, being able to hear back from everyone is incredibly important to us. So that way we can make sure that we're taking those learnings forward. So in the deck, and we'll also drop it for you in the chat right now, please feel more than free to just complete this additional needs survey. CalAIM is a multi-year plan. So this TA does not stop here, by any means. There is so much planning for TA next year. So please let us know exactly what your additional needs are. There is going to be a DHCS webinar on December 8th. So we are going to include that link in the chat for you as well, but you can access it in the deck. So that way y'all can go ahead and get registered for that. And please don't forget to apply for funding that's going to be coming online within the next couple of months. We've included the links for that in the deck as well. If we go to the next slide, I just wanted to remind everyone that the presentation resources are available on the CalAIM Links website. You can access that by visiting healthbegins.org/CalAIM. And I just want to give, if we go to the next slide, a very special thanks to our entire project team, which includes our partners at HealthNet and Anthem, our entire HealthBegins project team, our partners at Transform Health, our evaluator from Mount Auburn and Associates. And we just want to thank you all for joining us today. And we hope that you were able to take away something incredibly meaningful. And please feel more than free to email us at calaim@healthbegins.org if you have any questions in the future. And we will hang online for just a couple of minutes for anyone that might want to stay behind and ask a question. But if you don't have any questions, please feel more than free to contact us via email. All right, I think that we are good to go ahead and sign off. Thanks, everyone.